I'd like to officially welcome everyone and say hello on behalf of Asthma Canada. Thanks for joining us for our Be Asthma Ready on the Go this summer webinar. Right now, of course, wildfires and air quality alerts are affecting communities across the country, making it more important than ever that you know how to protect your lungs, and we're here to help you just do that. In today's session, we're going to cover how summer conditions like heat, smog, smoke, and pollen can affect your asthma and give you practical tips and tools to help you stay active, informed, and in control all summer long. My name is Jeff Beach, and I'm the President and CEO of Asthma Canada. And before we'd like to dive into today's session, I would like to thank our sponsor, Trudell Medical International and Trudell Healthcare Solutions, for supporting today's webinar and making this important conversation possible. So thank you very much, Trudell, for your sponsorship. A few quick notes. This webinar is being recorded. It will be made available on our website soon, and we'll be sending out links to attendees as well and those who registered. So please feel free to share it with anyone that you think might benefit from this information. A couple other notes. All attendees are muted at this point just to minimize any background noise and distractions, but we do encourage you to ask questions, and you can do that through the Zoom Q&A feature. We will try to cover as many questions as we can after Dr. Zoysa's presentation, but please note that this webinar is intended to provide informational advice, not medical advice. So we won't be providing any specific medical advice or addressing general asthma questions today. But if you do have questions about asthma, not specifically related to this topic, please reach out to the Asthma and Allergy Helpline, which I will talk about throughout the webinar today, and you'll have some information on how to access that. So with that, let's get started. We can advance to the next slide, please. So we want to start with land acknowledgement, and we want to acknowledge the Indigenous peoples of all the lands that we are on today. While we meet today on a virtual platform, we take a moment to acknowledge the importance of the land which we all call home. We recognize that those joining us are doing so from across various lands and territories. Asthma is a common yet serious disease that affects more than 4.6 million people in Canada. And about 5 to 10% of those diagnosed with asthma have severe asthma. It affects children and adults of all ages. Asthma Canada is committed to improving the lives of the Canadian asthma community through our mission pillars of education, advocacy, and research. We encourage you to visit our website, asthma.ca, or contact our Asthma and Allergy Helpline to be connected with a certified respiratory educator. And now I am very pleased to introduce you to our speaker for today's session, Dr. Maya Zoysa, who is a respirologist based in North Bay, Ontario. She currently serves as staff respirologist and internist at the West Nipissing General Hospital and is assistant professor at the Northern School of Medicine. Dr. Zoysa specializes in severe airway disorders and is passionate about respiratory education. Dr. Zoysa, it's such a pleasure to have you with us, and we thank you for doing this today. And I'm happy to turn the presentation over to you now.
Great. Thank you very much for that kind introduction, and hello to everybody who's joined us virtually. As the kind introduction already mentioned, my name is Maya Zoysa. I am a general adult respirologist here in Northern Ontario, and I deal with a lot of asthma and COPD and other airways disorders. So it is my pleasure and privilege to talk to you today about a little bit about asthma management, especially in the summer months, and how that might be different to other times of the year. So my speaker disclosures, basically I've done educational talks like this for pretty much every pharmaceutical company that deals with asthma medication, so I like all medications equally. Our agenda today will be talking about some of the seasonal changes that we'll expect in the summer months, how it affects people with asthma, how we can mitigate those risks, and what are the resources and tools available for us to help optimize management of your asthma, especially during the summer. Okay, so a little introduction to asthma. As mentioned earlier, asthma is something that affects millions and millions of people worldwide. People die of it every day when it's uncontrolled, so this is something we definitely want to try and optimize as much as possible. It's very common, especially in children, but it can affect people of all ages. So people can develop asthma at any time in your life, even when you're older and elderly. The prevalence is somewhere between 5 and to more than 20%. And there's no cure for this. So this is a chronic disease, but it is very manageable, and you can lead a perfectly normal, healthy life with appropriate management. Now, asthma, in essence, is a disease of inflammation. It causes inflammation in the airways. And what happens is you get increased mucus, you get airway thickening and tightening, which basically feels like you're breathing out of a straw. And these symptoms can cause you, or these issues can cause you to have shortness of breath, coughing, wheezing, tightness in your chest, and fatigue. So, what are the triggers, especially in the summer, that can cause you to have worsening symptoms? The big things we'll touch on are heat and humidity, air quality changes, and then the changes in a person's routine that can make you a little bit more vulnerable to asthma flare-ups. First thing is talk about heat and humidity. The things that are around that are things like very high temperatures can cause you to have difficulty inhaling and can also worsen pre-existing inflamed airways. Humidity often will just basically mean there's more water content in the air. It can make it more dense and make it difficult to actually inhale. So when you're already having inflamed airways or having difficulty breathing, it makes it harder for you to breathe the air in and out. Dehydration, which happens again in the summer months, especially when you're not keeping up with your water intake, can make you fatigued and feeling unwell. It can also make the mucus in your airways very thick and difficult to bring up, so that makes it even harder for you to cough and bring up phlegm. Indoor circulation is always an issue. So, say you're staying indoors, if you don't have proper air conditioning, that'll get rid of things like dust mites and particulate matter. It can actually make things a bit worse too. And then the big thing that we've all been talking about lately is wildfire prevalence. So already the wildfires have kicked in. People in my neck of the woods in Northern Ontario are starting to feel it. And so, of course, all that increased particulate matter can make you feel worse with regards to your breathing. Little diagram saying that climate change is here. The summers are getting warmer in general. It's a very busy slide, but basically the dark red line that's kind of on your left-hand side basically shows what the average temperature is over the months, and it's basically a lot higher than what our average is. So this is not going away. Hotter summers are here to stay, so it's better that we recognize these and try and manage them the best we can. This is the humidity index, which you've probably seen on before. Anything higher than 80% is very high humidity. Low humidity is 0 to 30%. And in the summer months, humidity tends to go up. So this is a little diagram of the humidity in different cities across Canada. Usually it's worse in the mornings and usually worse in the late summer months, so July and August. Now, air quality is also something that we have to pay attention to in patients who are experiencing asthma. The things that are involved in air quality are things like seasonal allergens, so pollen, grasses, weeds, all of that. We talked a bit about wildfire smoke, mold spores, carbon emissions from vehicles and industry, and ground level ozone, which we also see a lot in cars and industry as well. Seasonal allergens are something that flare up during different months, so it is important for you to know what your allergens are so you can anticipate what months or what periods may be worse for you with regards to your asthma. So, for example, if you're allergic to ragweed, August and September might be your worst months. If you're allergic to tree pollen, April to June may be your worst months. So just something to keep an eye on, especially if you're trying to do more strength activities during outside on the months that you know that your allergens may be flaring up. And of course, wildfires, this has been in the news quite a bit over, of course, this season and previous seasons, but Canada's, basically on fire a lot of the time. And so it affects pretty much any part of Canada, no matter where the wildfires are, because of wind patterns, it'll affect many different places. So this is, again, going to be an ongoing issue that we will be dealing with. And this little diagram basically shows that carbon emissions are also just continuing to go up over time. Again, not an issue that's going to go away, so trying to manage this is going to be an ongoing issue. All right. So now that we know that there's a lot of issues in the environment, the other thing that we have to look about with regards to your asthma management is how your routine changes. Big things that we pay attention to is that you're usually spending more time outdoors. And so if you have seasonal allergies, that means you're exposed to more triggers. Sleep changes, or if you're not sleeping as much, that can also affect your health. If you're traveling, you're going to areas with different air quality. You're often going to be in planes or trains or airports where you're around a lot of people, so higher risk of developing viral infections. You're potentially more likely to be more active. So after you've been fairly inactive over the summer or the winter months, now you're trying to get out and do more things. So if you've been a bit out of shape, you may notice it and feel more short of breath. Also, if your asthma tends to be exacerbated by exercise, that can also make your symptoms worse too. So this is another potential trigger to keep an eye on. And then the other big thing is medication adherence, especially for people who have seasonal jobs or are people that are in or out of school. The summer can be a big change in your schedule. And when you have any big change, you're often not going to have the same routines with regards to your medication. So people often forget to take their routine inhalers or forget to keep their reliever inhalers with them. And that can make you more vulnerable to asthma issues down the line. So, bottom line means summer means you're going outdoors more, you have more activities, but it also makes you more vulnerable to common outdoor triggers. And when people develop asthma attacks or exacerbations of the symptoms, often it's going to be outdoors, especially in the summer months. So they've done some surveys of people regarding this, and up to 30% of people with asthma will have an asthma attack or an exacerbation of their symptoms outside of the home. So it's very important, apart from just being adherent with your routine inhalers, that you always have your reliever or your rescue inhalers with you at all times so that you have access to potentially life-saving medication wherever you are. You can't just keep it in your truck or keep it at home. It's got to be with you at all times because you never know when you're going to be exposed to a variety of triggers that can flare up your asthma. So now that we've talked about things like humidity and air quality changes and ozone and all these things that can make your breathing worse, how exactly does it affect your asthma and your respiratory health? Heat and humidity itself can cause increased inflammation and cause your airways to tighten. So the picture on your left-hand side basically shows that with lower heat, your airways are generally a little bit bigger and have normal calibers. When you have increased heat, you get increased inflammation, which causes your airways to tighten. And as you mentioned earlier, humidity makes the air more dense and makes it difficult for you to breathe that air in and out. Dehydration is a big problem as well in terms of making the mucus that you're expectorating thick and difficult to bring up. And when you have a lot of mucus, they're thick, you can't bring it up, you have increased inflammation, and that can cause increased exacerbations or flare-ups or attacks of your asthma. The other big thing to keep an eye on is indoor circulation. So people notice often that the heat and humidity is bad, so they stay indoors. But if you don't have good indoor circulation, like if you haven't cleaned out the filters in your AC, you can actually be circulating more and more of those dust mites and pollen and animal dander and all sorts of other things, which can actually make your breathing worse. So that's something to keep an eye on. And a little bit more about wildfire smoke, because again, this is something that we're going to be dealing with a lot over the summer. It is especially dangerous for people who have pre-existing lung diseases, including asthma or COPD, but can affect people of all ages and genders, especially very young, very old, or with multiple medical issues. Wildfire smoke has a lot of things in it that can be noxious or toxic to people. So things like ozone, methane, sulfur dioxide, carbon monoxide, basically burning organic matter. And then the big thing that we talk about sometimes is something called fine particulate matter, or PM 2.5, which basically means little things that are about 2.5 microns in diameter, which means it's small enough that can get past your nose, past your upper airway, all the way down to the bottoms of your lungs. And that can cause increased inflammation, which can lead to an asthma attack. All these symptoms that you get from wildfire smoke and fine particulate matter exposure include shortness of breath, coughing, wheezing, tightness in your chest, and more mucus. This is a little diagram I got from the Health Canada website, which shows that This PM 2.5 is not just found in wildfire smoke, but is found in many different things that you may come across in your day-to-day life. Things like burning candles, woodworking, fireplaces, wood stoves, gas stoves, furnaces, and of course, tobacco smoke if you're smoking, or cannabis smoke if you're smoking cannabis. It not just affects the lungs, but it can affect your eyes and your nose, causing irritation. It can cause a decrease in your lung function, and it can aggravate pre-existing lung and heart diseases as well. So, of course, trying to remove yourself from these sources is the best if possible. Trying to increase ventilation, so opening windows, using a HEPA filter, trying to minimize exposures to things like, the cooking with a range hood, for example. All of these things can help minimize your exposure to potentially noxious substances. And of course, seasonal allergens are always something that you want to keep an eye on. Recognize what your symptoms are. If you don't know what your allergies are, try and get allergy skin tested as much as possible so that you can realize what seasons are not great for you, how to keep away from them if possible, using things like antihistamines when required. So pollen, dust, mold, insects. Pet dander is not really seasonal unless you're only seeing a cat once a summer, but potentially possible. And then, as we mentioned earlier, ground level ozone, often with vehicle emissions and industry emissions, and this can be a very powerful irritant to your airways. So now that we have talked about the things that can affect your asthma, how do we mitigate these risks? So how can we try and stay as healthy as possible, especially during the summer? So one of the big things you need to do is plan ahead. So, and this is one of the things that we often don't do. When you have asthma, but you're otherwise healthy, you go about your day, you don't really think of these things ahead of time. So what you need to do is, first of all, identify your triggers, try to avoid them as much as possible. You always should prepare and carry your medications with you. So make sure you're using your maintenance inhalers every day. Bring your reliever inhalers with you with all the appropriate things like spacers to make sure that you're able to take it properly. And you want to do things like consider the time of day that you're trying to do activities. So humidity is worse in the mornings. You might want to avoid that. You might want to avoid strength activity outdoors when the humidity is high or when the air quality is bad. So it's all about trying to manage your activity and your efforts depending on what the weather is. Things that can help you is like the Trusty Weather Network. They have pollen forecasts, which will tell you moderate or low or high. They also have something called the Air Quality Health Index, which is calculated using a combination of issues such as nitrogen dioxide, ozone, and that fine particulate matter we talked about. And they kind of give you a very easy scale of 1 to 10. 1 is low risk, 10 is very high risk. So, for example, if I was someone with asthma, I would not be planning to run a half marathon in a day when the air quality health index is 10. So you can use these very easily accessible measures to kind of determine what you should be doing safely on those days. And during the warmest and most humid days, you'll want to stay indoors as best you can. Try and keep the humidity lower with a dehumidifier or an air conditioner. HEPA filters can be very useful, especially to remove most of these particulate matters from your living environment. And staying hydrated is very important. Dehydration at the best of times makes everyone feel worse. And then if you already have airway inflammation and you're dehydrated, that mucus becomes thick like glue and very difficult to bring up. So quick tips for helping you to stay safe: staying indoors and ventilating as much as possible, making sure your AC is working appropriately, has the right filters to limit all the outside air circulating in your home. If you have to be outside in specific situations, especially if you're working in very dusty environments, using a mask or a filter to help out get rid of some of those particulate matter might be helpful. You want to keep the windows and air vents closed in your car. Check the air quality reports, and you can determine what activity you think might be safe based on what you're getting from the weather reports. And always make sure that you're compliant with your inhalers and you keep your reliever or rescue medications nearby at all times. So not just in your truck or at home, always with you. So now that we've talked a little bit about all the things that can worsen your asthma, how do we manage this? So whenever we're talking about treating a disease, there's always two big categories. There's lifestyle, which we've kind of talked about a little bit already, and then medications or pharmacotherapy. The lifestyle stuff is fairly straightforward. Easy to say, not very hard to do, not very easy to say, but not very easy to do. So things like quitting smoking, sleeping well, having a healthy weight, exercising, visiting your doctor, and then doing what your doctor says and taking the medications appropriately. All of these things would help, not just with asthma, but in generally for any chronic disease. And the big thing to understand is that people with asthma often don't have good asthma control. So, this is a survey that was done through the Global Asthma Report a couple of years ago. And when they did a survey of children, adolescents, and adults, in general, controlled asthma was only there for about 45 to 60% of the population. Worse in children and a little bit better in adults. But a good chunk of the population actually does not have good asthma control. And the reason for that is that a lot of people, patients and healthcare providers alike, don't actually know what uncontrolled asthma is. So this little diagram was extrapolated from the Canadian Thoracic Society, which gives you the criteria for uncontrolled asthma. And the big things here is that if you're having symptoms of asthma, so shortness of breath or coughing or wheezing or chest tightness, more than 2 days in a week, that is uncontrolled asthma. If you need to use your reliever inhaler more than twice a week, if you're having nighttime symptoms once a week or more, if you've had a flare up or an asthma attack where you need prednisone more than once in a year, these are all symptoms of being uncontrolled. And this is not always something that people recognize in real life. So, for example, I'll see a number of patients with asthma and I'll say, well, how is your breathing? How's the asthma control? And they say, Doc, it's great. And then I ask them how often are they using their salbutamol inhaler? And they'll say, well, about twice a day. So they think their asthma is controlled, but their asthma actually isn't. And why this is important is because when you're having symptoms more frequently, more than 2 or 3 times a week, more than, once or twice a night, this is a warning symptom that things are not going well with your asthma. And that basically is putting you at a more vulnerable state so that something else happens, like a little viral infection or a big change in weather, and this can push you into an asthma attack. So what we're trying to do is recognize the warning symptoms before they happen so we can get on top of your treatment. So, a major overview of asthma management is recognizing the symptoms, understanding what triggers you. So, that's easier said than done. Most of us who have asthma are healthy, you're on the go, you're not paying attention to these mild tightness or the fact you had to slow down because of your asthma or the fact that you're coughing more than usual. So, recognizing your symptoms, paying attention to it is the first step. The second step is determining what your triggers are. Is it heat? Is it cold? Is it humidity? Is it cat dander? Is it pollen? Is it a combination of these things? Is it stress? So all of these things, so recognizing your triggers will help you to be able to manage them. Then the next step is using the right medications. So making sure you're on the appropriate asthma medications, making sure that you're using them consistently and appropriately, which means with right inhaler technique. And then the next step is education, which is developing a personalized action plan, which means a way for you to help manage your own asthma symptoms based on how you feel. This is similar to a diabetic learning how to manage their sugar levels with insulin and with changes in diet. Asthmatics also need to learn how to titrate their medications based on their symptoms, based on their environment. So having an action plan will be helpful, something that you can create with your respirologist or with your primary care physician. So a little bit about what the asthma medications are. The mainstay of asthma treatment is inhalers and specifically inhaled corticosteroids. There are two types of asthma medications. There's usually a controller inhaler, which means one that you take every day routinely, and then you have reliever or rescue inhalers. We tend to call it more reliever inhalers because when you call it a rescue inhaler, it means that people don't use it until they're almost dying. So this is an inhaler that you use whenever your symptoms are worse than usual. So if you're noticing more shortness of breath or tightness or coughing or wheezing, you can take this inhaler, which opens up the airways, may reduce inflammation so that your symptoms can get more managed. The cornerstone of asthma medication is inhaled steroids, like I mentioned earlier. So if I go back to the initial slide, the corticosteroids are on your left-hand side, and then the combination ones, which is an inhaled steroid plus a bronchodilator, are on the middle one. The ones on your right-hand side, those are just bronchodilators. So salbutamol or Ventolin is probably the most common one that you've used. Now, the big thing to take home from this is that salbutamol or Ventolin or any of the just short-acting bronchodilators are not a treatment for asthma. It's a band-aid. It temporarily makes you feel better, but it doesn't treat the underlying problem, which is inflammation. And this is why being compliant with your inhaled steroids is the most important thing. And people, whenever they hear the word steroid, they start getting anxious. They know that steroids, like pill steroids, like prednisone, is bad for you, causes a lot of side effects, makes it blow up like a balloon, etc., etc. So often, and rightfully so, people are quite hesitant about steroids. But inhaled steroids are different to oral steroids. Inhaled steroids mostly just act on the airway itself. It does not get absorbed in the body, not like pill steroids. So you don't get the same side effects. The major side effects of inhaled steroids are hoarseness in your voice, or thrush, which is a white coating or yeast infection on the tongue. So these are, irritating side effects, but not life-threatening in any way and can be managed. But inhaled steroids in general are very safe and are used to basically control chronic inflammation of the airways. I just wanted to put this in, it's called the GINA Guidelines for Asthma Management, to show that there is a stepwise approach on how we manage asthma. And the bottom stepwise ladder here that you see was our initial stepwise treatment options, which was that everybody basically got a salbutamol or Ventolin type inhaler as needed. And then they would start adding an inhaled steroid, low dose, then medium dose, then high dose, and titrating up therapy from there. The issue with this is that again, people realize they feel better with their short-acting bronchodilator, their salbutamol or their Ventolin, and they mostly just focus on that, and they don't actually use their inhaled steroids, which is the actual treatment for asthma. So there has been a bit of a paradigm shift in the past few years where we're focusing more on giving people a reliever inhaler, which has an inhaled steroid and a bronchodilator to help reduce the inflammation, open up the airways, so you feel better and treat your asthma at the same time. And then you can start with a low dose of that. For example, Symbicort is a combination that can be used in this manner. Then you can do low dose routine Symbicort, higher dose routine Symbicort, and then you're going on to more stronger bronchial therapy, other pills like Singulair or Montelukast. And then for people with very severe asthma, there's also something called biologic medication now available too. The big thing though, before we get to that severe asthma, pathway is being adherent to your medications. So when we figure out what step in that asthma ladder you are supposed to be on in terms of treatment, the big thing is that you have to be compliant with that. And that's also quite hard to do. So in a study of asthma patients, up to 50% were not using their inhalers as prescribed. And this can be for a number of different reasons. It could be just because you're feeling well, or you don't really recognize when your symptoms are flaring up, so you don't think to take it. It could be because it's just, pain in the butt to take, or the thing is too bulky for you to carry with you, or because, you're getting some of the side effects, like a little bit of voice hoarseness or irritation on your tongue. So there's many reasons why people are not taking their inhalers appropriately, and this is something that should be brought up and discussed with your doctor so that you can find a combination or a regimen that works best for you, something that you can tolerate well, something that you like using, and doesn't cause any side effects. And as you can tell from that earlier inhaler chart I showed, there are many, many, many inhalers now. They all have weird names. It's not just the purple puffer, the pink puffer, or the orange puffer. So there are lots of combinations. So we had to find sometimes the one or the couple of inhalers that work best for you. So sometimes there's a little bit of trial and error involved. So what are some of the asthma management tools that we can use to help get your asthma better controlled? The first thing that I mentioned earlier was an asthma action plan. So this is basically something like a written chart that shows you what to do when you're feeling well, what to do when things are not going very well, and then what to do in an emergency. So this is a example of an action plan that's actually on the asthma.ca website. We usually categorize asthma symptoms in green, orange, and red. So green is good, orange, yellow, orange is, things are not quite going the way they ought to. Red is emergency, seek help right away. So an example of this, for example, on a green zone, if you're on Symbicort, for example, you can say, well, when you're feeling well, your normal Symbicort routine should be 2 puffs twice a day routinely, and you can take an extra puff as needed. Orange zone or yellow zone would be, the wildfire smoke is kicking up, or, it's very hot and humid days. And when you're feeling a bit worse, you should increase that. Maybe 2 puffs 4 times a day for a week or two until the air quality gets better or the wildfire smoke dissipates. And then the red zone is emergency. So if you cannot breathe, if you're struggling, if you're wheezing a lot, if you can't like say a full sentence, you try and sit up straight, you try to remain calm, you should take your reliever or rescue medication as directed, start using your action plan, and then you get help, which usually means you go to a hospital right away. Part of making sure that your symptoms are in check are always keeping your inhalers close to you at all times. Now, as I mentioned earlier, during the summer months, people are generally outdoors more often, which means that if you run into problems with your asthma, you're likely going to be outside. You're not going to be at home with all of your inhalers kind of around you in your kitchen table. And when you are in a flare up of your asthma or having an asthma attack, it is very difficult to use your inhalers appropriately. The big thing for all inhalers, whether they're pumps or MDIs or a dry powder inhaler, is that you should be holding your breath for at least 5 to 10 seconds to get all that medication into your lungs. And for anyone who's experienced an asthma attack or shortness of breath, you'll probably realize that's very hard to do. And then if you're not being able to take your rescue reliever inhaler medication appropriately, you're not going to get the full dose of that medication. You're not going to get the sufficient relief of your symptoms. And that can cause worsening symptoms where you might end up in a hospital or in a life-threatening situation. There was actually a study done a few years ago looking at how good inhaler technique was for MDIs or meter dose inhalers, which are basically pump type inhalers. And a whopping 86% of patients with asthma and COPD had errors using an MDI. And this is one of the most commonly used handheld devices. The problem is you need to have good hand-breath coordination. So pumping it the same time you take a deep breath in and hold your breath in for at least 5 to 10 seconds. The big errors that most people were doing were things like failing to exhale fully before taking a deep breath in with the ear puffer, failure to hold your breath in, if you're inhaling too fast or not deep enough, so the medication's getting stuck in the back of your throat and not actually getting into your lungs, failing to shake the inhaler before using it, and then failing to do all this stuff for your second puff. So I have a number of patients who do something like puff puff and not inhaling it, and they're not getting the full bang for your buck. And the problem is you're also probably going to have the side effects of your reliever inhalers, like high heart rate or feeling jittery or shaky, without getting the full benefit. And if you don't have inhaler technique, you're not getting the right medication delivery. That increases your risk of exacerbations, makes you need to go to the hospital or the walk-in clinic, makes you need to get things like prednisone and antibiotics more frequently, and it also increases your risk of death. So trying to get your medications in properly will avoid a lot of grief down the road. So spacers or air chambers can help to mitigate some of the common inhaler errors for MDIs. So as I mentioned earlier, when you put a puff directly into your mouth and try and puff the inhaler, half of that is getting sprayed in the back of your throat. It's not actually getting into the lungs where it needs to go. If you use an air chamber or a spacer device, you will get more of that medication into your lungs. It slows down the particles so it bypasses your throat, goes all the way down, and gets into the airways where it needs to work. Now, because we're also avoiding the tongue and the mouth best we can, we're also going to minimize any side effects of medication just sitting in your throat. So if it's an inhaled steroid, for example, that you're pumping, if it stays in the mouth and the throat, it can cause hoarseness in your voice or thrush. If you use an air chamber and get more of that medication into the airways, we'll minimize deposition in the mouth and minimize any mouth irritation that can happen. So, as we mentioned, spacers are very useful with the MDI inhalers. There are many types of air chambers and spacer devices available. Air chambers are a commercially available option. You can get spacer devices often free when you are hospitalized, or if you're going to do a breathing test, they'll often give you one for free. So, take whatever you can get. And as you can tell, I'm sure people have seen an air chamber in some way, shape, or form. They're great, but sometimes they can be a little bulky. So they've got a new device called Aero to Go or On the Go, which is more of a portable version of an air chamber. The reason for this is because, again, one of the big things, especially with my patients, when we have air chamber or an MDI, I always ask them, are you using your air chamber? And a good chunk of the time they'll say, Doc, I'm using this, especially at home, But when I'm out and about, it's really bulky. It's hard for me to take it. So I'm just taking my little inhaler and just puffing it out when I'm, going on work or out and about. And as we mentioned earlier, you're not getting the full bang for your buck when you use it that way. So this is a more portable version of that. It's easy to use. If you're more likely to bring an air chamber with you, then you can have better inhaler technique if you're using it in an emergency situation. It's plastic, it's durable, it's not going to break, and it's also a nice little way to hide your little inhaler in there as well. So again, just makes things a little easier to use. And this was developed with lots of asthma patients in mind. Children can put in their backpack, teenagers can put in their baggy pants, adults can put them in their purses or in their bags. So it's just making it more accessible for a broader patient population. This was designed with asthma patients in mind. People like the idea that they have something they can put in their pockets or put in their purses and go about. And when they looked at using a more portable air chamber, this air chamber to go versus just using a inhaler on its own, people would say that they needed to use fewer doses of their medication. So that means that they were getting more medication per dose. So they didn't need to use it as frequently. They felt more confident they're getting all the medication in their lungs. There are fewer side effects, especially if the inhaler has an inhaled steroid. And a little bit fewer emergency visits because you're able to manage this at home more frequently. And how you use a portable device, this air to go, is very similar to what you use in the normal air chamber. Actually, I have one of the little gizmos here. Basically, you hide the inhaler in here. This is where the pump goes. You pump into the chamber and you breathe in and hold your breath in for at least 10 seconds if you can. If you can hold your breath in for 10 seconds, all you got to do is take deep breaths in and out 3 or 4 times to get all the medication that's in the air chamber into your lungs. And you use this with any spacer device. It's very easy to clean. You open these things up a little bit, you put in your dishwasher once a week or so just to get rid of the residue that's inside the chamber. So whichever spacer device you end up using, as long as you use it consistently and you use it accurately, it will get more of the medication into your lungs and it'll help your asthma control in general. So, in summary, asthma is a chronic disease. It's a chronic inflammation of your airways, but it is variable. So it can fluctuate based on season, based on triggers. So the big thing that you need to do is recognize what your asthma symptoms are, recognize when your asthma symptoms are not controlled, and recognize what your triggers are and how you can manage them. Uh, Proper inhaled medication compliance and technique are very important. So if you're supposed to take an inhaler every day, use it every day. Time it with something. I often say time it with brushing your teeth because you usually have to rinse and gargle afterwards anyway. And then for your reliever inhaler, when you're out and about, make sure that you have it with you at all times. If it is an MDI or a pump type inhaler, make sure you have a spacer device with it so that when you run into trouble, when you're having problems breathing, you can get the full dose of that medication into your lungs. Make sure that you have an asthma action plan. So you know what to do when things are good, you know what to do when things are not going very well, like with forest fire smoke or change in weather or humidity. And then you know what to do if there's an emergency. So it could be getting your prednisone, calling 911, getting help. And if you realize that your asthma symptoms are not controlled, if you realize that maybe the inhalers that you have are not working for you, then please talk to your primary care provider or your friendly neighborhood respirologist and see if they can work with you to try and find an asthma regimen that works best for you and will give you the best care possible. All right. If anyone has any questions, go ahead.
Thanks so much, Dr. Zoysa. That was great. You covered an awful lot of ground. That's some really good information, very practical and engaging presentation. So thank you. We really appreciate that. Before we do have some questions that have been submitted, and the quick Q&A Zoom is open for anybody that has questions that they'd like to submit. Before we get into those, I just want to mention again that Asthma Canada does offer a free bilingual and confidential service, our asthma and allergy helpline, which is staffed by certified respiratory educators or CREs, and they can answer questions that you may have about any aspect of asthma management. Could be for yourself, could be if you're a parent of a child with asthma, any situation. So no question is too big or too small. Our team is here to support you every step of the way, and the contact information is available on our website as well as in the chat in today's webinar. As I mentioned, we did have some questions that have come in, and we encourage you to keep asking if you have some. Some of the questions might be more suited to the asthma and allergy helpline or to conversations with your healthcare professionals that you work with, but we will do our best to answer some of them here today. So one of the questions had come when you were speaking about the use of spacers or aero chambers, and one of the participants mentioned that they're surprised that you had mentioned this for adults and thinking that these were devices that were really designed for children. So can you just expand on that a little bit around the importance of these devices being used for people across all ages?
Yeah, so I guess it's more common to use it in children for sure because we don't expect them to be able to, time your breath in the same time as you're pumping something and hold your breath. But I've seen people use their inhalers incorrectly across all patient populations, young, old, it doesn't matter, especially in our older populations. So, people who are more elderly or more frail, they're also a big population that doesn't or has difficulty with what we call hand breath coordination. So, inhalers or spacer devices are very helpful in those situations. The other thing is that no matter, let's say, say you're, a young, healthy person, you're like, I can hold my breath in for 5 seconds, no problem. The issue is also if you're running into an asthma attack or you're running into a issue where you're wheezing, you're coughing, you're short of breath, it's very rare that even for a young, healthy person, you're going to be able to hold your breath in appropriately. Taking a deep breath out first, then taking a deep breath in, then holding it. That's very hard to do when you're right now having an asthma attack. So that's why having a spacer device that you can use across all populations, all genders, all ages, will get more of that medication in. There's almost no downside to using it apart from the fact that you have to get the device and it might be a little bulkier than just having your little inhaler. But the upsides are potentially quite helpful.
Yeah, absolutely. And it's really shocking to think that some of the information you presented included the fact that over 80, I think it was 87% of people are found to not be using proper inhaler techniques. So anything we can do to improve that would be a benefit for patients. So clearly they're useful across the entire patient population. So thank you for explaining that. Another question related to spacers is from someone who asks, should we be using spacers with corticosteroid inhalers as well as rescue or rescue inhalers? My apologies.
Good question. So, yes, I mean, like I said, there's two types of inhalers for the most part. There's dry powder inhalers. So, Symbicort, the Ellipta inhalers, those are all powders. Anything that's a pump type inhaler that goes is an MDI or mere dose inhaler. And all of those medications should ideally be used with a spacer device or an air chamber, including the corticosteroids. The reasons particularly why we would want to use them with corticosteroids as well. So, for example, inhale steroids with things like Flovent, combinations with things like Zenhale or Advair. So, all of those would be helpful for two reasons. One is you will minimize that spraying of the medication directly into the mouth and the throat. So you'll get, less hoarseness in your voice, less thrush, which are often side effects of these inhalers. You will also get more of that medication into your lungs, and that's where we want the inhaled steroids to work, like in your airways. And if it's going in the back of your throat, it's not actually getting in where it needs to go. So if you can get more of your inhaled medications into your airways every day, routinely, that will help. So all pumps, no matter what type of medication it is, ideally you should use with a spacer device.
Okay. Lots of questions coming in around spacers, so I'll cover them. Then we have a few others, other related to other parts of your presentation. But one person asked, how often should a spacer be replaced, and is it common for insurance companies to cover the fees?
Very good question. So, inhaler spacer devices don't often need to be replaced. As long as, the seal is working properly, all the pieces are working together, you should be just fine. As long as you rinse it and wash it once a week or so, you should be fine to use it. I know people who have used the same air chamber for years, but if the seal's not working, or for example, like with this little area, if you pump and you see like, parts of the inhaled medications like coming out of the sides, you realize is not working properly, for example. And if you're not sure, you can take it to your pharmacy, they can check it out, or to your primary care provider or a straight therapist. So I don't have a potential lifespan on these things, but I've had people use them for a few years and they're fine. In terms of cost, now that is usually a very big barrier to using them as well because it's not something covered by governments. Um, Depends on where you are. So I'm in Ontario, so I kind of know how it works, but I think different provinces will have very different rules, so I can't speak too much to it. Some insurance companies will cover air chambers, like private companies, some don't. No idea which one does which. The only thing you can do is try and hope for the best. I have a bunch of samples of spacer devices that I use, for example, that I give to patients who don't have coverage, so that at least they can get medications. But yeah, it is unfortunately a bit of a gap in care, something similar to actually affording your medications in the first place.
Great. Thank you for that. And I think you covered, but maybe you could repeat the part about cleaning them because it's obviously something that you want to, keep clean in terms of devices. So one person had asked, do you need to wash it? And she or he had been told to wash the casing every so often. Is that true?
Yeah. So again, there's probably no, hard and fast rule of how often you should. In general, I tell my patients to rinse it in soapy water once a week. Or some of these devices, one of the pictures with the Air to Go one, you could actually just open it up and put it in your dishwasher, like on the top shelf, and run it with your other stuff. Again, once a week. So nothing fancy, just like like the very mild dish soap or the baby bottle soap with water once a week or so.
Right. And there are many participants commenting on how wonderful it is to know that there are more portable devices. The Aero Chamber to Go, for example, is something that is much easier to carry around with you. Is there any drawback to using that device as compared to a more traditional Aero Chamber spacer?
Not that I'm aware of. Now, to be fair, I don't think we've done a lot of head-to-head trials on things like medication deposition in one or the other, but it's all essentially the same thing. This is not high-level technology. Like, I mean, even just something like a cardboard, toilet paper roll almost can do something similar. So it's really just making sure that you have a seal with the inhaler, something that you can, it has a one-way valve so that when the medication gets pumped in the chamber, it stays there until you breathe in the medication. So really, however that gets done, it doesn't matter. So as long as the device is working properly and it's relatively clean, you're good to go. So any spacer device is better than no spacer device, in my opinion. So whatever it makes it easier for you to go about and do your day and use your inhalers with a device would be ideal.
That's great. Certainly makes it more practical to carry as the title of the webinar, Asthma to Go. We're on the go here, so that does certainly help to make it more practical for people to carry around and use properly. So, with respect to some of the summer, maybe unique challenges that people with asthma might face during summer, one question came in. Someone said they really have challenges when they're riding in a motorboat. I know this is kind of a specific thing, but it might be something that others could relate to. And the person says, riding in a motorboat triggers my asthma. How can I manage this?
So it's a good question. There's certain things. So, for example, like exercise-induced asthma, and I think probably a motorboat might be something similar, is when you have a lot of high airflow, that can sometimes trigger inflammation in your airways. So, same thing with exercise-induced asthma, is you're breathing very heavily. There's a lot of turbulent airflow in and out, and that can cause inflammation. I'm going to assume, and I'm not a motorboat enthusiast myself, but I'm assuming that is something similar that can happen is you've got a lot of wind in your face, probably a little bit more humidity or, little water particles. So all those things could be triggers for you. So how can you manage this? I mean, avoiding is usually the best thing, which is probably not easy to say, especially if you want to go out on a boat in the summer. The other thing that might help is using your reliever inhaler before you're doing an activity that's going to trigger things. So, and that applies to almost anything that usually triggers going outside on hot, humid days, exercising, exposure to cats or whatever it is that it triggers your asthma. Take your reliever inhaler beforehand. They usually last on general, like even the shortest acting ones last about 2 to 4 hours. And if you use it appropriately with your air chamber, you'll get more medication into your lungs. It'll last for hopefully that whole time so that you'll be less triggered by those symptoms.
Yeah. And someone just commented as well, perhaps wearing a mask would help. when on a boat or in that sort of circumstance?
It's definitely, I mean, there's no harm in trying these things. So, I mean, give it a shot. If it works, great. If it doesn't, at least try your reliever inhalers ahead of time. It definitely could work. But that's a good question. It's not one I've had recently.
Right. Well, we tend to get lots of great questions during these webinars. So thank you for those that are submitting them. There's still questions coming in. We're going to try and cover as many as we can over the next few minutes. One question that I think a lot of people might relate to when they hear it is about carrying medication when you're outside in the heat, in the humidity. Does that sort of environment around heat and humidity, for example, during the summer, affect the medication itself? Should people be concerned about how they're carrying it with them if they're, let's say, for example, out at a beach or something along those lines when it's very hot, very humid, and they're in the direct sun?
That's a good question. Usually all these medications are safe between 15 and 30 degrees Celsius. So generally the symptoms that the temperatures that we're comfortable with. So if you're comfortable, the inhaler is usually fine too. Yes, because especially MDI inhalers are in a pressured canister. It would make sense that it's like very high heat. So like in the sun cooking, probably not ideal. So it doesn't mean that you can't bring it with you, just like keep it in a backpack, keep it in like, a darker environment, would be manageable. I don't think it's going to explode or anything, where it's going to be unsafe, but it makes sense that you don't want a little, metal canister to be in the hot, hot sun for prolonged periods of time. So
Yeah.
make sure it's in your beach bag or under an umbrella and you should be just fine.
Okay, thank you. Someone asks about how difficult it is to have routines with children during summer, especially if they're attending camps, day camps, sports camps, those kind of things. Do you have any advice around setting that sort of routine or anything people can do preventatively when they're trying to make sure that their kids are prepared during the summer and all the activities that they're engaged with?
So also an excellent question, and it is very hard. Like I have two little kids, and they don't do anything I tell them to do. So, in general, it really depends on. And again, I guess the disclaimer here is I'm not a pediatric respirologist, so I don't deal with very small kids. But in general, having a routine is important. So if your asthma is severe enough that or significant enough that you should be taking an inhaler every day, realistically, there are inhalers that are once a day or twice a day. If you can only figure out in your child's schedule once a day for, an inhaler, like a routine inhaler, then talk to your doctor and say, like, look, twice a day is just not working for us. There are once a day longer acting ones available. So that might work a bit better for people who have difficulty with compliance or difficulty taking something twice a day. And for people who just can't remember to take something every day, no matter what you do, the reliever inhalers that have a little bit of a steroid and the bronchodilator, so things like Symbicort or Zenhale, might be a better option because that's better than just having your bronchodilator alone, so no steroids at all. So try to time it with anything that your child is doing routinely. So if it's first thing when they wake up, when they wake up after bed, brushing their teeth every morning, having breakfast, something like that. If you can time it with that, for their routine inhalers, and then for their reliever inhalers, it'll have to be something that they have with them at all times, something that they can put in their pocket or in their backpack. If depending again how old the child is. You can talk to their counselors or their teachers or whoever they're with and say, this is their reliever inhaler. They need to use this. If you see that they are struggling, please remind them to take it. And so it's going to be a lot of education for the people your child's with, your child, and hopefully a combination of those things will help them get the care they need.
Great. Thank you. And I will say, you go back to the importance of having asthma action plans, as you pointed out during your presentation, is really essential, and that helps to establish that routine. I love the idea of timing with brushing teeth, for example, just getting people into that routine, because that's something that we often hear about is patients who fall out of that routine. They're feeling better, they stop taking their medication, they're a little lax about it. That is what oftentimes will lead to them having further exacerbations. So it's really good advice. And we do have a lot of resources even to help people talk to counselors or teachers about asthma with their children, available on our website as well at asthma.ca. One of the other questions that came in was around humidity and the effect, and you did touch on this in your presentation. Is there anything that someone can do rather than avoiding the outdoors with humidity, but is there anything, if someone has to be outdoors, any particular advice around humidity if that's something that, is potentially exacerbating their condition?
The two things I can think of, apart from again using your reliever inhalers ahead of time, so before you go out into the humidity, sometimes fans are helpful too. So like a little handheld fan, which is kind of just blows a little bit of air around you, so it just makes that air like directly around your face a little less thick and heavy. There's not too much else you can do, unfortunately. Like staying indoors with a dehumidifier would be great. But yeah, so trying, a little bit of a fan or just more airflow around you, and using your reliever inhalers a bit more frequently would help. If you have an action plan where you can ramp up your routine inhalers, so for example, like increasing your Symbicort to 3 or 4 times a day, you would definitely want to do that during your high humid days too. So it just gives a little bit more anti-inflammatory effect for your lungs.
Right. Great. Another question that's come in is from someone who's maybe talking about one of the myths or things that you might hear about controlling asthma properly. And they ask, is it true that taking a reliever before medication every day is the better way to take asthma medication? I think they're asking, should you be taking a reliever before taking your maintenance inhaler?
So that's also, I keep saying it's really good questions, but they all are. I've heard that a lot as well. It is not necessary in most cases, in my experience. So, a lot of the combination inhalers with a bronchodilator and the inhaled steroid, the bronchodilator bit will act almost as fast as Ventolin, so within 5 or 10 minutes. And the inhaled steroid then is just doing their job. So you don't necessarily need to use your reliever, your Ventolin inhaler or salbutamol before your long-acting inhaler. I know it makes sense. It's like you open up the inhaler first and then you go in. Unless you have very severe disease, so very severe asthma or severe COPD, most people have good enough lung function that they're going to get that medication in. It's more about technique more than just giving more medication. The downsides of using your Ventolin every time you're using your long-acting inhaler is that you're just using a lot more Ventolin or salbutamol. And you're just using extra medication you may not need. It can also cause some side effects like making your heart race. So for more severe patients, potentially yes. For your average healthy run-of-the-mill asthmatic, usually you don't need to.
Right. Okay, thank you. Well, we're right up against the clock here in the hour, so thanks so much to all who submitted questions. If your question wasn't answered, you can always reach out to us. Go to our website, asthma.ca, or give us a call to connect with one of our certified respiratory educators. Dr. DeZoysa, we want to take this opportunity to thank you again for a fantastic presentation. That was wonderful, very informative, one that I know is going to live on beyond the live audience today. For those that were asking questions about this presentation, yes, it is being recorded. Yes, we will be posting it on our website and will be on YouTube as well. So we're happy to encourage you to share it with others throughout your network and your family. Anyone who could participate could benefit rather from this information. And finally, I also want to take this opportunity to thank our sponsors, Trudell Medical International and Trudell Healthcare Solutions, for making this possible. They're one of the many wonderful partners that we work with. As a nonprofit organization, we do rely on the support of partners like Trudell, as well as our donors across the country. So we thank you for your continued support, and we encourage you to continue to ask questions, to develop those routines, use those asthma action plans, and be prepared for summer. And I hope you all have a wonderful and active and healthy summer. And thank you again, Dr. DeZoysa, for the wonderful job you did today.
Thanks so much for the opportunity. Take care.